And Dr. Lara Devgan is here now joining us to talk a little bit more about some of the trends. And thanks so much for joining us. I know that, Mark and I were talking about how it really kind of is, it's not taboo anymore, and people are pretty open about it, even celebrities now.
Yeah, the biggest shift is not really that more people are having procedures, it's that more people are talking about them.
Mm.
And I remember even 15 years ago, Botox was kind of like a hush hush thing. People
Yeah.
weren't being so open about it, and now people are talking about it on their social media, and it's not a secret anymore.
Mhm.
I think we're definitely seeing that from my perspective. For decades, cosmetic procedures have existed behind closed doors. But today, social sharing has really transformed aesthetic medicine from a private decision into a public conversation. And I really think that transparency is better than secrecy here because although we want to people to share what they're doing and that's helpful for education, it also creates more realistic expectations about what procedures can and cannot accomplish. So I think patients are increasingly more educated before they even enter my consultation room. So in many ways, honesty is healthier than pretending that beauty just naturally occurs without any intervention.
Yeah, and we're seeing. I saw anyway. Gosh, I think it was like last week that there are now some 40-year-old women, 45, 41 even, who were talking about how they're getting like a deep plane facelift, which, to me, I'm going, okay, that sounds pretty young to be doing that, but they're kind of normalizing it, and for whatever reason, they seem to be a good candidate.
Yeah, I think we're all thinking about aging earlier, and this is part of a broader longevity conversation. In prior generations, we saw people waiting until aging became obvious.
Mm.
But now younger patients are interested in prevention and maintenance and kind of the forever 35 look, so to speak.
And in your practice, if you have a patient who posts their before and after results, are you finding out that that is good for your business? People will say, "Hey, where did you have this done?" or "Who's your doctor?" and that sort of thing.
Absolutely. I think it gives people valuable examples of what's possible and what's not possible. And, that idea that social media can be problematic also has a flip side, which is that it can be part of the solution. It's democratized information about procedures, and I think it's helped people understand anatomy, recovery, complications, and options at a much earlier time point.
Can you talk about the varying costs of different procedures? Because there's been information that, Chris Jenner paid 500 grand or something for a facelift, and then so and so paid, 50 for a facelift, and so paid 250 for a facelift. Why is there such a huge difference in price?
I think you see a large range based on the experience of the plastic surgeon, the particular aesthetic, their wait list and demand structure, and also the geographic region where surgeons and patients are based. So there is a wide range in options for surgical procedures as well. And so, in much the same way that renovating your kitchen can be replacing your microwave or getting Carrera marble everywhere, plastic surgery can range from something very tiny like Botox to something more dramatic and invasive like a face and neck lift.
Hmm.
Are you seeing any trends right now? Again, social media driven probably, but where people are coming into you for one specific thing, or is it just kind of a general look over and see what they could have done?
I think the biggest trend is the idea of seeking a harmonious global appearance. So people are not coming in for just one procedure. They're thinking about global facial optimization. So
Wow.
not getting rid of one wrinkle right here, but how does the balance, proportion, and symmetry of the cheekbone and jawline go with the nose and chin, and so on. The other big trend I'm seeing is that the new aesthetic is natural. And this is a really important change in course from the overfilled and overpulled aesthetic of prior generations.
I was going to ask you about filler. We actually just had an episode on the show that I do talking about filler and how, people have kind of gone overboard with it. And you can tell, when someone has just someone injected their face with a bunch of filler. And you're saying that that is going away, and what is kind of replacing that?
I don't think filler is going away. I think bad filler and
Mm,
overdone filler is going away. And what we really saw was a swinging of the pendulum into a really extreme place where there are dysmorphic faces with puffy cheeks and
mm,
puffy lips all over the place. So that is definitely something in the past that we don't want anymore. Some patients are not candidates for filler. And in those patients, we think about fat grafting as nature's filler or an alternative way to replace lost volume. But I do think it's important to clarify that there will always be a role for adding volume to replace lost
mm,
structure of the face with filler or fat.
mm.
And sometimes I know we see, the before and after of people who've had a facelift or, some procedure done, but we don't see the in between time where the bruising and the swelling and
Yeah.
that recovery time. So you've got to be pretty honest with your patients about what that's going to look like,
Mhm.
right?
Absolutely. The before and after is fun, but we really want to think about the before, during, after, the who, what, where, why. All of the ramifications of surgery include important decisions about the risks, benefits, alternatives, and indications. And what we do in plastic surgery is medicine. It's not magic. And to get someone from point A to point B or point Z does require a little bit of downtime and recovery.
Mm. Can you comment about some of the men, like some of the, celebrity men who are getting things done? And you can see there's a before and an after, and like Bradley Cooper is one that comes to mind, Ryan Seacrest, one that comes to mind, Simon Cowell, another one. And there's a they frankly look different. They don't really look like I think maybe what we envision them looking like. What is going on with this trend of some of these men and specifically celebrity men?
I think what we're seeing is the loss of facial identity.
Hmm.
Sometimes people get into a situation where they're chasing every minor imperfection instead of thinking about the coherent attractiveness of the face. And especially with some of these public facing figures, we're seeing a feminization of the male face
Hmm.
Hmm.
and a loss of some of the architecture that we all think of as what made them handsome. So, one of the most important decisions a skilled and aesthetically minded plastic surgeon has to make is how do you balance identity and perfection? And how do you keep someone looking like themselves rather than chasing a textbook idea that can frankly look a little bit disturbing?
Yeah, I
Yeah.
mean, I think if you're someone like Bradley Cooper, just don't mess with your face. It's like
No,
it's what's everyone knows you by that, and
I
it's
know.
I think that's weird when you're not up and coming. You've already made it, and
Right.
now it's like you can definitely see something was done.
Yeah, I think there's something to be said for like, the Robert Redfords of, the day that were just kind of a rugged looking dude. And, in my opinion, he looked great,
Yeah,
and Bradley Cooper looked great. And I feel like he just looks a little different. He's a little bit unrecognizable. I mean, you can still recognize
yeah,
him, but he just
yeah.
looks different.
Yep.
And I don't know if that's a good thing or not.
Yeah.
Well, I totally agree because beauty is not created in dramatic transformations. It's really created in millimeter level refinements that preserve identity, restore harmony, and help someone look like the most vibrant version of themselves. So if you're taking people away from that North Star, something needs to be dialed back.
Yeah. Well, I think remember Jennifer Grey? Remember
Yes,
her?
that was legendary.
Yeah,
Yeah.
she had a
Yes.
nose job and her career just went down the
Yeah.
tubes.
Well, doctor, thank you so much for joining us. Dr. Lara Devgan joining us. Very interesting conversation. We really
Yeah.
appreciate you.
Hmm.
Thank you.